Welcome, dear friends, to another podcast on Bless India Prayer Health Talk in this brand new year. And what do we do at the beginning of the year? We try to forget the past because the past is gone. We don't think about the future because the future hasn't arrived yet. But we want to live in the present and enjoy it and make it a dream come true. But sadly, many of us are really stuck there because of health impediments. And one of the biggest health impediment is pain and pain in the knee. It doesn't spare anyone, the young and the old. The young look at the past and say, I wish I hadn't worked so hard and played so much in sports and was involved in sports and abused my knees. The old, you get into any senior citizens group, they'll be talking about kneecap and knee injections and knee replacements. And that's the topic of the day. And so, my friends, I thought we have a very experienced doctor, Dr. Clement Deenadayalan, an orthopedic surgeon who can discuss this at length with us. Dr. Clement is such a compassionate person. And before I go on, let me tell you where he graduated from. He graduated from Christian Medical College, Vellore in 1965, and he did a specialization in orthopedics in Stanley Medical College, Chennai. He then joined Skadar Memorial Hospital, Ranipet for 15 years. He was in the Department of Ortho in Ministry of Health in the Sultanate of Oman for 23 years. After that, he joined the tribal missions in Anaikatti, Coimbatore, Bethany Medical Center for another 10 years. Now, Dr. Clement himself is a cancer survivor. He suffered with cancer, but he continued on. And that is why he's compassionate about people who have health impediments. When I fractured my ankle in 3 places in the United States, and though I had expert care there, I used to call Clement often and he wouldn't hesitate. He would guide me, he would tell me what to do, and he would guide me regarding exercises till I was back on my feet again. And that's why I thought I must introduce Clement to you all this morning. For you, it's evening. And so, welcome everyone. And so, I won't take any more of Clement's time. So, the floor is open to you, Dr. Clement. Please take over from here. Dr. Clement Deenadayalan.
Good evening. Today's topic given to me is it's not a very pleasant subject to discuss in the beginning of the year, but still I hope it would be of some help to some people. Going straight to the subject, why knee? Knee is a special joint in the body. It has some unique features. First of all, it's a very large joint. It is a superficial joint. It doesn't have much muscle coverage. So it is more prone to injury, wear and tear, and so on, resulting in pain. And also, it has some special functions apart from movement, because almost all the joints, except a few, are meant for movement in the body. But this knee has some more special functions. So, in order to carry out the special functions, it has some special structures. So, we'll just go through the functions of the knee. I can just enumerate the functions. First of all, it is meant for mobility. Smooth, frictionless mobility of the knee is very important for a comfortable life. And second thing is stability. That is, when you're walking, when you're running, when you're jogging, or in any activity, your body has to be stable. And so you need a stable joint. And the third function that it has is weight bearing. That is, when you stand, your whole body weight passes through the knee. And also, when you're running, when you're jumping, it takes some increased additional load. And there is a fourth function in which the knee may not be directly involved, but still any damage to the knee can affect that. That is growth. Because in adolescents and children, uh, the lower end of femur, that is upper bone, and the upper end of the tibia has a place called growth plate or epiphyseal plate. And that is where the growth occurs. It is very close to the joint. So any damage to the joint can indirectly affect growth. So that is another important thing that we see in the knee. So now there are some special structures which helps to do the function smoothly without any problem. First of all, mobility. Mobility has to be smooth. So the surfaces of femur and tibia are covered with what is called an articular cartilage, which is very smooth and it glides over each other. In fact, in the diagram, I have shown some gap in between, but in reality, there is no gap because these cartilages of the upper and the lower bones, they are touching each other. They glide over each other. But even in an X-ray, you can see these gaps because cartilage is not seen in X-rays. Only bones are seen. So it looks as if there is a small gap in the X-rays. But whenever there is a damage cartilage, this looks narrow in an X-ray because that part of the cartilage is damaged. So the bones come closer to each other. So that's about the articular cartilage. And there is one more part in the knee which helps in this smooth gliding movement. That is, if you can see the top on both sides, there is a brownish red line which I have drawn. That is called the synovial membrane. That secretes an oil called synovial fluid, which is essential for the smooth functioning of the knee joint. So now this articular cartilage and the synovium, which secretes this oil, they make sure that the movements are smooth. And of course, the joints are useless without muscles. You can see some pencil lines on top. Both the front and the back of the knee is attached to the muscles on top, that is on the thigh muscles. The front muscle is called quadriceps because it consists of 4 separate muscles joined together and then it gets attached to the lower bone called tibia. And the same way, on the back, you have what is called the hamstring muscles, which gets attached to the back of the lower bone. So when these muscles contract, that moves the knee. And also there is a third bone, which is part that is called patella. That's the small triangular one in the front, in the lower picture. So that also has an important role to play, as you would see later. So for movement, you need these 3: the articular cartilage, the synovium, and the muscles. Then the second function is stability. That is, while you are standing straight, the joint has to be strong and stable. Otherwise, it will not be able to support your weight. So first of all, we have what is called the joint capsule. That is the pouch-like thing that is covering the front and the back and the sides. It's all around like a bag which is attached on top to the femur and the lower area to the tibia. That's a fibrous bag-like thing which is holding the bones together. And some parts of this fibrous bag called capsule gets thickened, and that is one on the inner side, that is called where I marked as M. M is medial, that is inner side. L is lateral on the outer side. That is, one is called medial collateral ligament, and the other one is called lateral collateral. These two collateral ligaments, they support the knee when we are standing. And then in between the two bones, there is a X mark. I don't know whether you can make that out. That X mark is called cruciate ligaments. They crisscross each other, and that is attached inside the bone. So they are very important for the stability of the knee joint. And this cruciate ligament is not found in any other joint. Only knee joint has got that. And of course, for the stability, the muscles, and which continues as tendons downwards, and they get attached on either side, and that gives real stability. And of course, you have to have a strong bone to support yourself to be stable. A soft bone also can cause problem. And this small triangular bone called patella, that also supports the knee from the front, and that also gives additional stability to the bone. Now coming to the third function, that is weight bearing. Of course, the two big bones which are positioned over each other, and they bear the entire body weight. Suppose if you jump or when you run, there is additional weight or additional force which is acting on your knee joint. So for that, God has created two shock absorbers. They are called the menisci. They are tough tissue which is placed on the surface of the lower bone called tibia. These are called semilunar cartilages or menisci. See, if you see the upper joint surface of the lower bone, you see these semilunar tough cartilages. They bear the brunt of all the force which is exerted on the knee joint. And they are very prone to injury, particularly in sportsmen, those who play football and other sports activities, about which we'll discuss later. So these are the weight bearing parts. And then, as I said, it has got growth plates. On the right side picture, you see two lines, one the lower end of femur, upper end of tibia. These are growth plates which keep growing until a person comes to full measure of his growth. Then they disappear. They become bone. They are like any other bone. So when you take an X-ray of a child or an adolescent, you can see these lines. But if you take a X-ray of an adult, you won't be able to see, because once the growth is completed and full, they disappear. Okay. So these are the special structures in the knee. So whenever any problem comes to any one of these parts, then there is pain. It may be the inner structures or the outer structures. It may be the muscles or tendons or the bone itself or the cartilage, anything. Whenever it gets injured, there are so many things which can get injured here. It is the duty of the doctor who attends a patient to find out exactly what the problem is, and then to give the right treatment. So if you go to a doctor with a pain in the knee, they may ask you a lot of questions. So please don't get annoyed, okay? Because only then they'll be able to pinpoint the problem and give the right answer. And of course, to examine the knee, there is a definite protocol. If you follow that, and if you do all the tests in a systematic way, by just taking history and clinical examination, you can fairly come to a conclusion or a diagnosis just by clinical examination. And then you will have to do the further investigations to support what you are suspecting, just to confirm. Okay, nowadays uh, the trend is changing, because when you go to see a doctor, before examining the patient or touching the patient, they want all the investigations to be in front of them, and then only it makes things easier for them, but sometimes it may not be necessary. So it's a waste of money for the patients. So always it's the duty of the doctor to examine the patient properly, come to a conclusion, and to do investigations like X-ray, and then do the needful treatment. Now coming to the pain itself, the pain could be an acute pain or something which happened just immediately, or it could be a prolonged or chronic pain. And let us see some of the causes of acute pain. First of all, injury. It could be a mild injury or a moderate injury, like in sports activities, or it could be a severe injury, as in a road traffic accident or two-wheeler accident. These can cause major problems. So when you come to the milder type of injuries, sometimes it will be painful on walking. Patient will walk with some pain or discomfort. Sometimes the pain will be intermittent, it may not be constant, or on a particular type of movement, it can cause pain. So that is for the mild pain. So this happens when there is some pulling or strain of the muscles or ligaments which is supporting the knee. Suppose if there is pain associated with swelling of the knee, then there could be two possibilities. Suppose if the swelling develops gradually over a matter of 1 or 2 days after the injury, usually it is the synovial membrane which is injured, and that will start secreting fluid slowly because of the irritation causing the swelling. But if you have an injury and the knee starts swelling very rapidly, then there is possibility there is blood collection inside, and there is what you call hemarthrosis. So then that has to be attended to immediately. Sometimes what happens after the injury, you may not be able to straighten the knee fully. If you try to straighten your knee just short of the full extension or the full straightening, it will get locked. Then if you swing a little bit and then try to do it, it might get released with a click, painful click. And that is a sign when your meniscus or the seminal cartilages are injured. Or for some patients, after the injury, they may not be able to walk because the knee is unstable, knee is shaky. So in that case, it could be a major injury to the ligaments outside, and also possibility of the cruciate ligaments inside which are injured. So any of these injuries are possible. And suppose if you are not able to stand without putting the weight, it really hurts a lot. That means you have a fracture inside, because any small crack so will not allow you to put your weight on the knee and then stand. So these are various degrees of injuries which can cause pain. And sometimes the patella also can get injured. Either it can get fractured or it can move to one side called patellar dislocation. So that is also possible. And the second cause of acute pain is inflammation of the joint. Inflammation, when you say, usually there are certain characteristic features like pain, swelling, warmth, redness, and loss of function. These are the characteristic features of any inflammation. And the commonest cause is infection. Usually it's associated with fever. And there are some causes which cause acute pain because of the metabolic changes in the body, particularly when the uric acid in the blood goes up. It causes pain and swelling, which is quite painful, and that is what you call gout. Gout is common in the foot, but knee joint also can get involved, where the uric acid crystals are deposited in the synovial membrane. That causes this kind of pain. Now, these are about acute pain, causes of acute pain. Now coming to chronic pain, which gradually increases and which lingers for a long time. You may not be very much disabled in the initial stages, but as the years and months go on, it becomes more and more. The commonest cause is what you call osteoarthritis, that is the wear and tear of the joint. And this is the common cause is age related, that is old age, just like a machine which wears out, your knee joint also gets worn out. But this can happen in some younger age group also, where there is repeated small injury to the knee joints, which are not attended to properly in the early age. That can also cause these chronic problems. And people who are living in the hilly areas, like the tribals who walk up and down, who keep walking on uneven ground. So they have additional load on the knee. So even at the age of 35, 40, you find a lot of them developing these degenerative changes. And then suppose if a patient has got or person has got a deformity of the lower limbs, that is, sometimes one leg may be weaker or shorter, so that he'll be depending or leaning more on the normal leg. So there, because your body weight travels mostly through the normal leg, and that gets worn out earlier, causing this kind of a problem. And of course, sports activities in younger age group, like football players, football, volleyball, basketball, where you twist your leg and also jump up and down, the cartilage gets damaged, and these people develop osteoarthritis quite early. So these are mainly about this degenerative problem. Then there are some chronic infections, some autoimmune disorders like rheumatoid arthritis, in which also the knee can get involved, causing chronic pain. Now, when you have this acute or chronic pains, what are we supposed to do? First of all, when you have a mild trauma, that is like a sprain or a twisted knee, or suppose you are walking on an uneven ground, suddenly you step into a pit unknowingly, that causes strain on the knee. Or you are climbing down a stairs and you miss one stair and then step into the second stair down, that causes additional strain that can cause pain. So what you have to do is, first of all, rest or restricted activity. If you are able to walk around, it's okay, but any activity which causes increase in the pain, try to avoid that. And support to the knee is advisable. You can have, depending on the severity, you can just have a kneecap for a few days or if it is severe, where even the movements are painful, there are braces which we can buy and apply, and then that will until the pain is relieved. Then you have pain relieving medicines. Usually, the general advice is that you should restrict the use of pain relieving medicines as much as possible. Take it when necessary for a short period of time. You should not continue it continuously for a long period of time because it can have so many other side effects. And then there are a lot of external applications. Now, balm which contains menthol and what is called methyl salicylate, that is oil of wintergreen, that gives a slight burning and warm feeling when you apply it. That helps to increase the circulation around the knee, and that can relieve your pain. Nowadays, to enable you to make life simpler in applying, they have spray and also even roll-ons, just like perfumes. You can roll on these local applications. And some of them contain an anti-inflammatory drug called diclofenac, which you can take orally also. But in order to avoid prolonged use, you can use this local application. But in these cases where you have a mild to moderate pain, one thing you should strictly avoid is massaging, because many people, when they have a problem like this, they come home and then they'll apply some local these balms, and they ask somebody to apply it. They will with all sincerity, they'll apply maximum amount of pressure and force and massage that area. This is an injured tissue. When you apply more pressure, it gets more injured, and that causes more problem. So if you just leave it at rest and taking some medication on and off, the massaging invariably increases the problem, and it will put you down for a longer period of time. So I usually advise every patient who takes these balms and spray local applications, tell them not to massage. Don't apply pressure. In case you want to apply, just apply it with a single finger, because this is very important, not only for knee, for any muscular skeletal pain in any part of the body. When you want to apply something, apply gently, and you can even apply some uh, warm application. Acute injuries, ice or cold application is helpful. But if it lasts for a long time, in order to increase the circulation, you can have some warm application. Even warm application is helpful in chronic pain also. Anyway, now coming to the sports injuries, that is the injury to the meniscus and the ligaments and so on. Except for these minor injuries, all the other categories of injuries, it's better to go to the hospital and see an orthopedic surgeon as early as possible, because you cannot wait until it becomes worse. So if you cannot walk properly, if it gives you a lot of problem and pain, you can go to see a doctor. It is for them to make the right diagnosis and then give you treatment. As far as the ligamentous injuries are concerned, now arthroscopic procedures are available. That is what you call minimally invasive procedures. Through an arthroscopy, they can repair the torn meniscus, or they can remove it if it is too much damaged. They can even repair the anterior and posterior cruciate ligaments. Any capsule or tear they can repair. So all this can be done through arthroscopy in a well-equipped center and where the doctor is well trained in arthroscopy. That is important. So you must choose the doctor where you go. Now coming to chronic pain, that is what you call osteoarthritis. Um, it starts mildly, then it gradually keeps increasing. So when you take an X-ray, usually you have to do an X-ray for these chronic patients with in a standing position so that the cartilage damage can cause narrowing of this space in between, which will give you an indication how bad the damage is. Because the earliest sign in an X-ray is narrowing of the inner side of the knee space, knee joint space. That is called narrowing of the medial compartment. So once you diagnose early, then you can follow these conservative measures which can avoid you can avoid surgery completely, or you can at least postpone it. That is, first of all, you must keep the knee mobile, because usually what happens when you get up in the morning, you will find your knee stiff. So what you have to do is to sit at the edge of the bed, swing your leg for about 1 or 2 minutes, and then try to get up. And then that will take care of the stiffness and the pain. So this mobility is very important. So we have to keep maintaining this mobility. Second thing is, we must keep the joint stable. Why I'm saying this is, see, when you have a painful knee joint, when you are walking, you always have a tendency to put your weight on the opposite leg. That is the normal leg. So the normal leg becomes stronger and the muscles of the affected leg becomes weaker. So when the muscles become weaker, the joint becomes somewhat unstable, and instability produces more pain. So it's a vicious cycle. So in order to cut this vicious cycle, there are some muscle strengthening exercises which are very simple, which you can make it as a habit, and you can continue to do it in any position, sitting or lying down, even while standing, if you get the idea. And that way, you have to keep particularly the uh, muscle which I mentioned, the quadriceps, that is containing 4 muscles in front of the thigh, that gets wasted and becomes weak even if you don't walk properly for a short period of time, maybe 2 weeks, 3 weeks. Gradually it starts becoming weaker. So in order to avoid this, and once it becomes weaker, as I said, that vicious cycle continues: weakness, instability, increased pain, again further weakness, further instability. So you must avoid that, and you must start these exercises. It's a simple exercise, that is, when you lie down in the bed or sit on the bed with your legs straight, keep a small rolled towel under the knee, and then you press over the towel with your knee itself. Sorry for the poor quality of the picture. So you see the knee joint in the middle and a small rolled towel underneath the knee, and then you just compress that with your knee itself, not with a hand. You just press it, you will find the muscles on the front of your thigh contracting. Just hold that pressure for a few seconds, then release it. Then hold it down and then release it. So this, once you get used to it, you can do it even sitting on a chair. So you can just sit on a chair, keep a stool, keep your knee straight, and then press it. This you can do when you are reading newspaper or when you are reading the Bible or watching television. because unless you do about 200 to 300 times every day, this will not work. But it is very simple. It is painless. Even in a painful knee, this can easily be done. That is keeping the knee straight, just pressing it down and then keeping it for a few seconds and then releasing. Then this front muscles of the thigh, they will contract when you press and then relax when you take it up. So you continue to do this. This is called static quadriceps exercise. So this static quadriceps exercise alone can relieve you of this weakness and instability, by which you will feel better. I am very confidently saying because this has worked for my wife and she is much relieved with her pain by doing this exercise. And whenever she misses this, the pain starts again. So I can confidently refer it to anybody. So that is about muscle strengthening exercise. So first of all, mobility, that is the swinging exercise, and this static quadriceps exercise. These two simple procedures can go a long way in avoiding or reducing the pain in this degenerative uh, arthritis or the wear and tear of the knee, which is causing the pain. Then the third thing is you have to keep the joint warm, particularly in cold weather. It's better to avoid exposure to cold. And even warm applications are good. Usually, we don't recommend hot water bath because sometimes it might overheat and then cause burns. So, just pouring warm water on the knee, it will help, or what you call hot water fermentation, that will also help. And of course, there are local physiotherapy appliances available with the physiotherapist, what is called pulsar shortwave diathermy, which will pass heat through the joint, to the deeper parts of the joint, which can cause release, or it can relieve the pressure and the pain, and also it will increase mobility to some extent. And then there are some drugs which help in maintaining the health of the articular cartilage. A drug called glucosamine, then chondroitin, then alpha lipoic acid. Sometimes you get it in combination, but glucosamine itself is a good uh, dietary supplement because I think in Western countries these are available in supermarkets or across the counter. You can get glucosamine, and it is more like a vitamin which helps in the maintenance of the cartilage health. So these are some of the things by which you can either avoid surgery or you can postpone surgery. Now, coming to the question which Dr. Hansa was mentioning, whether you should operate or not to operate. Nowadays, for osteoarthritis, knee replacement is readily available everywhere, that it has become a fashion to get knee replaced. But it is always good to have your own knee as long as possible in your life, because that is the natural God given tissue of the leg, which serves you better than an artificial supplement or substitute. It mainly depends on, first of all, you should understand the knee replacement surgery is never an emergency. You can always postpone it, you can always think about it when you feel no other, like all the uh, conservative measures that you mentioned just now. If none of them work, still your disability is increasing day by day, then you can consider surgery. That is, it depends on the degree of functional disability. And also it depends on the pain tolerance, because each individual is different. Some patients can, some people can tolerate more pain. Some people cannot tolerate even little bit of pain. So uh, for them, maybe an earlier surgery could be necessary. So that's why I said, as long as possible, try to maintain your own knee. There are so many options for this surgery. One is the total knee replacement. That is both upper and the lower bone, that is femur and tibia. You remove the damaged joint surface and replace it with a prosthesis. And now, since there are people who strongly recommend maintaining the healthier part of the joint, now they come up with what is called unicondylar replacement. That is, replace only one half of the knee, leaving the healthy part intact. So that is unicondylar, which may be technically a little more difficult, but it's quite effective, they say, because I know first-hand experience in these knee replacement surgeries. So, and then there is something called notchplasty. That is, in the lower end of femur, there is one area of the lower end which does not take part in weight bearing. These two projections on the upper bone, they are called condyles. And in between these condyles, there is a smooth area covered by this articular cartilage, which is not helping in weight bearing. It doesn't come into contact with the lower bone. So you take small bits, plugs of bone and cartilage, and then punch it into the damaged cartilage. That's another method which is available now. Olden days, they used to correct the line of weight bearing. That is, normal leg, usually it is slightly curved inward, what is called bowing of the leg. Not very obvious, but there will be a small gap between the two knee joints when you stand straight. And then because of that, as I said, the inner portion gets worn out earlier. So then once you correct this line of weight bearing and slightly correct the angle of the lower part of the leg to outward direction, and then when you stand, your weight will go to the outer side of the knee, and that will reduce the damage in the inner side. This is an old form of treatment, but before this joint replacement came, that was only the surgical option which was available. So, in general, try to keep your knee as long as possible by following all these conservative methods which we have mentioned. And as and when it is necessary, the doctor who is treating will decide which is better for you, whether you have to do both sides or one side, and so on. So that's about the pain in the knee. But as I was preparing for this, I was reminded of a Bible verse in Ephesians 4th chapter 16th words, where Paul compares the body of Christ, which is the church, the members being united with each other by joints. So the unity or the link which binds the church together is compared to a joint. But then when I read that passage from verse 11 to 16, it almost enumerates all the functions of the knee joint, which I mentioned. First of all, building up growth. It says until the growth, your stature comes to that of the standard of Jesus Christ. Then only your growth is complete. So the here we found that the growth plate remains active as long as a person grows. Once that growth is complete, that action stops. And secondly, this 13th verse, it says, you become mature to the fullness of Christ. So that there again says, until you mature, your activity continues, this growth activity. And then it says, you should no longer be carried by every wind of doctrine. Verse 14, that indicates instability in the church. So a stable joint prevents instability. Same way, our doctrinal wavering will stop once we are stable with the word of God. And verse 15, it says, speaking the truth in love, which binds us together. That is the smooth functioning of the church. It depends on the oil in the joint and also the smoothness of the articular cartilage. And that's what we studied. And here it says, that is the love of God. The oil is the love of God, which keeps us smooth or harmonious, we can say. Then, of course, the 16th one, it says, all these are joined together with joints. The unity, the stability, and the smoothness of function, the growth, all that we saw in the knee joint are all mentioned in these verses. I mean, it is just an observation which I found. Maybe if you go home, you can meditate on that. With that, I finish my talk. So I can stop with that.
Yes,
In
thank
case,
you, Dr. Clement. Yes, it was wonderful. Yes, this is what I like about Dr. Clement. He will tell you even small things like when you have pain, you want to massage an ointment, don't put pressure. Don't put pressure on it. Small things, you won't get it anywhere. People won't get it. So now I throw open the floor to you all. Please, those who want to ask questions, you can ask any question you want, and that's the advantage of this podcast. So please go ahead and ask him whatever you want to ask.
Sorry, I just wanted to say it's a very, very good practical class, Clement, and congratulations, and it was very, very useful. Thank you.
thank you. Thanks for the compliment. I hope maybe some small detail might be of helpful to you or the other people also. Thank you.
Yeah, yes. Thank you, sir. Thank you, Dr. Clement. I want to ask one thing. Actually, whenever I eat some sugar or some sweet, then I get more severe knee pain. Otherwise, I'm okay. What could be the reason?
Medically speaking, there is no direct correlation between joint pain and the increase in blood sugar. But
no, if I eat any sugar, very sweet.
Yeah, in your practical life, you found that taking sugar or sweets causes pain. The only advice is to avoid it or reduce it as much as possible. Otherwise, there is no direct link because like certain foods like red meat, which will cause increase in the uric acid level, can cause pain. And there are some which can cause allergic reaction, like the autoimmune problems can produce some kind of allergic reaction which can cause joint pains. So in such cases, we have to find out which causes, what kind of a food material causes this reaction or increase in the pain, and you'll have to avoid that. That's the only.
Sister Anita, you have a question?
Yes, I have a question. Thank you so much for a very helpful talk, Dr. Clement.
Yes.
I would like you to, I would like you to tell us a little more about. I have a friend who's 75, who's got bowed legs, and the inner knee. What you very exactly described, the inside of the knee is painful and there's a bit of instability also. Can you help us with a little more detail on that? How to help somebody like that?
How severe is the pain?
She's
Is he
in
able to
very good
walk?
health. She's very good health, walking, everything. But the pain has started. Yeah. And it's sometimes unstable on her feet.
Uh-huh. How bad is the pain? But she's able to walk, isn't it?
Yes, yes. When she overdoes it, then it pains a lot.
Yeah.
And
What would be the approximate distance she can walk without pain?
I don't know. I've not asked, but I think about
Maybe
just
half
under
a kilometer.
Just under a kilometer.
Yeah. In that case, the surgical option is not absolutely necessary. So she can still, I told you, there's two things. That is to keep the knee mobile and keep it stable by the simple exercise which I showed. And if she continues that, and if she can carry on walking, so to the pain limit, then she will be fine. Actually, sometimes, what happens when you take an X-ray of the degenerated knee, the changes would be so gross and sort of intimidating that you feel that something has to be done. But as long as the pain is less, as long as you are able to walk, as long as you are able to move, then you should carry on with the conservative methods. If she is staying in a cold place, then she has to cover her knee as much as possible. And also, particularly this static quadriceps exercise is a very, very useful, simple exercise which you can do throughout the day in any position, doing other things. You need not even concentrate. Once you start doing it, it will become a habit. So once you do that, your muscles become strong, and that will support your knee, and that instability will go. Once instability goes, your pain will also reduce.
Yeah. So this is exercise 3 and 4, which you showed us.
Yeah, that's right.
Okay. Thank you. That's been very helpful. Thank you. I wish she was here today. That would have been so much better. Thank you.
Is she in Kunnur also?
Yes, she's also in Kunnur.
So then
I'm not in Kunnur at the moment. Yeah.
Yeah, but the weather factor is also there. She has to keep her knee covered, particularly when she goes out for walking and all that. So that has to be taken care of.
And I also think from what you're saying, downhill is not so good.
We should be careful. We should be careful.
Okay.
So because downhill, you are likely to take a misstep. Sometimes when you're walking on uneven surface, you're climbing down, even climbing down stairs. Suppose if you accidentally miss a step and keep down, that will cause severe pain, even in a normal person. So more so in a person with a osteoarthritis.
Thank you. Right now I'm in Texas. I have to be careful because it's snowed everywhere. Walk on the snow. Thank you so much. That was very good.
Welcome.
I hope there's a recording.
Yes, there is a recording. You could contact any one of us for the recording.
Okay. Okay. Thank you, Dr. Hansan.
Clement sir, thank you for that exhaustive and wonderful talk on knee joint and starting right from anatomy and then going on to the treatment. Just one thing I want to again stress is weight loss. If you're having knee pain, because knee is a weight-bearing joint, so it can't overstress the need for weight loss. So losing about even 4 or 5 kilos of weight would help you to relieve the pain. Am I right, sir?
Yeah, you're absolutely right. Actually, I missed it. Thanks for reminding that and then adding on to the list of conservative things. But only problem is, for many people, weight loss is a real big issue by itself. And as long as that is taken care of, particularly in older age group, definitely it helps weight loss.
Thank you, sir.
Thank you, Dr. Sachi.
Yeah.
Yes, good evening, John here.
Yes.
Thanks to doctor,
Yes.
for detailed and very simple illustrations and examples. Okay, by the way, a year back I had a fall and a hip bone fracture. Uh, Screw is being fitted at the
Yeah.
left hip. Now the thing is that I
Okay.
have to recover completely and walking and everything, but at times I get pain at my thighs, and if I'm not doing any exercise or something like that, so my movements become little bit different and people can observe it. Otherwise I'm like in normal walking. So what should I do and
How
what
long?
diet should I take?
How long have you been since you had the surgery?
This I had in April 23.
April 23. So it is
Yes,
year and a half,
year and a half. Yes, going to be
or
year
a
and a
little
half.
more than, yeah, a year and 8 months. Sometimes the implant which is inside might
Yes.
cause some irritation to the tissues, but if it is tolerable and if it is not very troublesome, you can carry on with that. But usually, in case, is it a hip fracture? You had a dynamic hip screw fixation, or is it a joint? This thing replacement arthroplasty?
No, I fell down from a building. I fell down from
No,
a
no.
building, slipped steps,
Okay,
and a hip
okay.
implant is there. Implant is there.
Implant is there.
Fracture was there. Yes, implanted the titanium screw rod.
It is screw and rod.
Permanent. Yes, yes, yes.
Okay. So yeah, this screw and rod, if it is very troublesome, it can be removed after 2 years. But whereas prosthetic replacement, that is including the head of the femur, that round thing, that has to stay on for life. But if it is only screw and rod, it can be removed after 2 years, which might be of help to you if it is necessary. But if it is left inside, nothing happens. You can live with that because nowadays they use metals which are compatible with our body. So very rarely the metal itself produces any reaction. But after doing this surgery, the scar tissue inside, it takes a very long time to become relaxed and like normal tissue. So the scar itself at particular movements, at particular kind of activities, it can give a pulling pain. So the only thing is to keep moving and then trying to be as normal as possible, unless it is very painful. But if you come to a point when you feel that this nail and screw, they are giving problem, it can be removed after 2 years.
It's a proximal fitting, and doctor told it's permanent, and I'm 60 plus now. So doctor told me let it be. It's no problem. It's compatible, and they are told it's permanent. Because I asked him whether it's replaceable or what, removed or what.
Yeah. No, it can be left inside. There is no problem at all. But as the days go by, gradually that scar tissue will become normal tissue. See, the cause of pain, one, it could be due to the irritation of the implant. The second cause is the scarring inside. It is not only the skin, but all the tissues which are divided, they'll have scar tissue. It takes a long time for that to be replaced by normal tissue. So until then, this pulling pain will be there on and off. So if you can manage with that, gradually it will settle down.
So on an average, how much time it will take to get the inner healing?
It is. The healing is complete. You mean the bone healing, by now it would have united strongly. And also the soft tissue healing is also there. But our body healing mechanism is such that it always forms a scar inside. That is this tough fibrous tissue which forms the healing tissue. And this healing tissue takes a long time to get converted into the normal tissue like muscle or tendon or whatever it is. So to get back to that normal texture, it takes time. So until then, you will have this tightness, pulling pain in particular positions and so on.
And
So
can I do, like, I was a sports person, a little bit of jogging. Can I do it?
You try walking first. Long
Walking,
walking.
yes.
You are doing. So probably that should be sufficient for the time being, because as age advances and also your because you had this surgery, fracture and all that, the strength of the bone may not be as the normal leg. So in view of such a situation, it is good to have a milder exercise than jogging. That is, jogging, you are having a jerky movements, no? So every time you run, so there is additional load on your bone and joints. So in order to avoid that, you can have brisk walking. Brisk walking is as good as jogging as far as exercise is concerned. Maybe you can take a longer walk. So that will take care of the exercise part of it.
And you just showed the diagram and showed that keeping the towel or soft pillow or anything below the knee and pushing it.
Yeah.
Yes, that exercise, my physio had shown it and I used to do it. And then another was reverse walking.
Yeah.
Reverse walking.
Reverse walking.
Yes, yes.
Okay. So any exercise which doesn't cause pain for you, you can take. Even jogging, after some time, you start short distance at a slower pace, then you can gradually increase it. Then as long as you can tolerate, or as long as you have a pain-free jogging, then nothing like that. Since
and what do you suggest? Do's and don'ts.
Like anything particular you have in mind?
No, any particular suggestion like do's and don'ts on exercise or food or anything?
Yeah, lifting heavy objects should be avoided.
Okay.
Anything, I do not know how heavy you are, but try to avoid putting on weight. So those are the only two things I can say, depending on your diet habits.
And they say that after a certain age, our body, what we say, slowly, gradually degenerates. So there is anything that this fitting will get loose or something like that? Nothing like that, no?
No, the present that nail and screw fixation usually doesn't get loose. If it gets loosened, then it will cause some irritation that can be easily removed. There's no problem because your bone would have united by now. That's why they give a maximum time of 2 years. Because after 2 years, what happens? The whole implant is covered by a new bone. So then it becomes more difficult to remove the implant.
Okay.
So in case you want to do it, you must do it at the end of 2 years. Okay.
Okay. Thank you. Thanks for your time and good advice. Thank you.
Welcome.
Thank you. Any other questions?
Yeah, one thing I want to advise is he asked for do's and don'ts. One thing I'll say is don't do your treadmill. Am I right, sir? Some people, they do vigorous treadmill walking and injure the knee.
Yeah, this treadmill is as bad as jogging for a person with an injured leg. You know, it's more or less the same mechanism that you keep walking. So instead, you can go for a outdoor walking at a slower pace. You know, it gives you more fresh air and better atmosphere. You can breathe in, you can have some breathing exercise also, as Dr. Hansa does when she takes out her dog for walking.
Yeah, I think we all need love and fresh air.
Yeah, true.
I
So
just want to thank Dr.
Yeah.
Clement for talking about a knee replacement part. It's become very common these days, everywhere, upstairs, downstairs, all my neighbors have got replaced knees. Even Dr. Raju was having. So it used to ponder my mind,
of
like,
course.
is it safe? How when should they be going for it? And it was kind of a scary thought to have something artificial in your body. So thanks for telling that. Keep your knees as long as possible. So that's a good advice, and I want to stick to it.
As far as
Thank you.
As far as you are concerned, you are too young for that.
No, but nowadays it's become so common, so I kind of preparing my mind for future. Thank you.
No. Welcome.
And we
I was
can we
about
be
to
on our
ask,
knees?
can I ask one question?
Sure, Dr. Smita.
Up to what age, is it okay to do knee replacement? I mean, is there age factor which matters? I mean, can it become too late after a certain age?
No, the thing is, like any other major surgery, the concern is only regarding your anesthetic fitness. As long as you are fit for anesthesia, there shouldn't be any problem, because it's
So
only
even
the
at the
lungs
age
and
of
the
80 or 85?
yes. Actually, my neighbor who is staying opposite to my house, he got his both the knees replaced in his 80s, but at the age of 89 he passed away just a few months ago. But until then he was quite comfortable with that. Yeah. So upper age limit
Okay,
is
because
no concern.
what
As
I
long
believe
as
is that, oh, sorry. If the knee muscles are strong, then it helps in recovering. I know of people, whose knee muscles are not strong, and if they don't exercise, physiotherapy is very important. Otherwise,
exactly.
they keep having pain for a very long time.
Yeah, that's why I said you need not go to a physiotherapist for exercise. No, this simple exercise which I told you, if you keep doing it regularly, say about 200 to 300 times every day, you can do it while reading newspaper or sitting or watching TV, any position you can do it. And that will keep your knee stable. And without that, if you get operated also, post-operative period recovery will take a longer time, because your knee muscles are not strong enough to hold your joint. So again, you'll have to have a more vigorous physiotherapy post-operative period, which might be painful. So in order to avoid that, even before surgery, they continue to do these exercises regularly. That will reduce the pain and also keep your knee strong. And even in the case of getting operated, it will give you a good support.
Thank you, doctor.
I think the final thing is you have to kneel and pray. Sorry, that was a joke.
Well, kneeling is also a good exercise until you find yourself unable to bend your knees. So that's why every morning you keep swinging your leg. Probably with that, you should be able to kneel down in the night. So morning when you get up, or afternoon when you rest and get up, swing your leg for some time. That will keep your knee mobile, and you should be able to bend your knee to the extent of kneeling down.
Thank you, Dr. Clement. You could see that your talk was much appreciated by everyone here. And thank you, all of you who participated today. Thank you so much for your presence. So God bless you all. So I would say good day to you all, and wind up this podcast. Thank you, everyone.
Thank you, and have a good day.
Thank you.